and to Mohab as well for this incredibly informative session. We will move to our next session about the psychosocial effects and coping with a scarring alopecia diagnosis. This will be presented by Dr. Kristen Losico. Dr. Losico is an associate professor of dermatology and the director of the Skin and Cancer Unit at NYU Langone Health. Her expertise is in hair and scalp disorders and also autoimmune connective tissue disorders. Dr. Losico is also a member of SAF's board of directors. She is passionate about addressing the impact of alopecia on confidence and quality of life. Dr. Losico is a national and international lecturer and has authored or co-authored over 70 peer-reviewed publications and 10 book chapters. Over to you, Dr. Losico.
Thank you so much for that wonderful introduction. I'm going to share my screen here. Okay, we're going to go in speaker mode. Okay, thank you so much for that lovely introduction. My name is Kristen Losico, and I'm an associate professor at NYU Langone Health. I do much of my research is focused specifically on alopecia, both non-scarring and scarring alopecias. And my peer-reviewed journal articles are above 130 now. So we've been very, very productive at NYU. My mentor is Dr. Jerry Shapiro, and him and I do all of our research together. So I'm very fortunate to be at an institution that supports research and has a world-renowned expert who is a maven to really pave the path for the rest of us. Today, we're going to be speaking about scarring alopecia and how it specifically impacts our coping, mental health, and the journey to acceptance with scarring alopecia. These are my disclosures. And our learning objectives today are multiple. First, I'd like us to recognize and appreciate alopecia as more than a cosmetic issue. I have no problem introducing that to this cohort of people as well. To recognize associated psychosocial implications of scarring alopecia, identify strategies for navigating life with scarring alopecia, discussing the paths toward acceptance, and discussing the need for scarring alopecia advocacy as well as more research. Here's my lecture outline. Let's get started. So these are actual patient quotes or testimonials, many of which that have reiterated the fact that people feel unseen, unheard, and sometimes not validated when they go to speak, even sometimes to their clinician and friends and or family members. And I hear this both for scarring as well as non-scarring alopecias. And these are actual patient testimonials at the end of visit. So really this is, it really warms my heart to see that after I spend time with my patients and we're talking through diagnosis, expectations, and treatment plan, that many people, when they leave the office, feel seen, heard, validated, and most importantly, advocated for. So my favorite quote is, "Thank you for being my advocate." And we're going to talk about a little bit about how we can be advocates for each other as well as ourselves. So remember, so this is really specific to women, and I have many women who come to my office that choose to cover their hair for religious reasons. So I really want to reiterate that it's really important to not listen if someone else is telling you it doesn't matter if you have hair because you cover it anyway. We all know that if a woman chooses to cover her hair for religious reasons, it's for public, right? So I tell my patients, I don't care about anything that's in public. I care how you feel about yourself when you look in the mirror. So whether you choose to cover your hair with a hijab, a gele, a shidel, a tickle, a veil, it matters most how a woman feels about herself. So here are some key facts about scarring alopecia. As of 2013, up to 7% of hair loss patients were reported having scarring alopecia. And we know that the number of patients with scarring alopecia has risen significantly over the years. And this is in part due to our increased ability to identify the disease as well as an increase in disease incidence. We're going to talk about a little bit how SAF is helping to contribute toward that data. So this is really to reiterate that multiple studies have shown that quality of life is impacted in scarring alopecia specifically. We know anxiety, depression, as well as social isolation are significant in this population specifically, so you're not alone. So I'd like to share this video, and this is a video that a video series that we made specific for alopecia areata, but I do think it still is relevant here because it talks about the psychosocial impact of alopecia areata, and in this case, alopecias in general, I think can be extrapolated. So let's watch this video together.
Beauty comes in many forms.
So this is my baby. It was one of the first scars that I got when I started losing my hair a lot and I couldn't hide it anymore.
We are all the sum of our experiences, and everyone's experiences are different.
So I was diagnosed with alopecia when I was 5 years old.
I had to fall in love with myself.
In this series, we're talking about alopecia areata.
It isn't just hair, it's the whole persona of a person.
We are one puzzle piece to help someone gain their identity back.
We are taking a deep dive into the nuances of this complex autoimmune disease. We know that when we are armed with knowledge, we can be better physicians, colleagues, friends, family, and individuals.
All right. So let's talk a little bit about an additional psychosocial impact of cicatricial alopecias and some of the specific studies that have been done. And this was one study showing that there were 23 patients, so a small cohort. However, they asked patients with scarring alopecia specifically to complete a modified version of a quality of life questionnaire, and nearly 3/4 of patients had moderate to severe psychosocial impact of their hair loss. Here is another study assessing quality of life and general health of patients, specifically with lichen planopilaris, using a dermatology-specific quality of life questionnaire, as well as a general health questionnaire in a slightly higher cohort of patients at 41. And nearly 71% of those patients had moderate to extreme impacts on quality of life. And 63% of patients were at risk for psychosocial disorders, including anxiety, depression, and social isolation. So let's talk a little bit about seeking support, a strategy to help navigating life with uncertainties. And this I really adapted from the APA website. So if you can go to the bottom of the screen and you click it, cut and paste that web address, and you can see that much of this was taken verbatim, and I adapted it a little bit to what I thought was specific for our conversations today about navigating life with uncertainties. First, I want to talk about the importance of counseling. There's a lot of stigma in society surrounding the importance of mental health. Many of us, including other clinicians, see therapists on a regular basis for talk therapy to help to work through the challenges of life and how we can help to be the best versions of ourselves. So don't think this is specific to just people with scarring alopecia. All of us want to find ways to better navigate life with our uncertainties. Just remember that it's important, number one, to be kind to yourself. So have patience with yourself and really try not to compare your life to that of someone else, which is very hard to do with social media and a lot of the platforms that we have available to us today. And avoid dwelling on things that you can't control. Remember, when uncertainty strikes, many people will immediately go to a worst case scenario. And I see this very often in clinic when people start Googling scarring alopecia and they see someone who's lost nearly 100% of their hair. And obviously that will be very traumatizing for someone to see. And then we start worrying about things that may or may not ever happen to us. So let's try to get out of the habit of ruminating on negative events, especially if we can't control the things that may not or haven't even happened to us yet. Engaging in self-care is also really important. So try not to allow stress to derail your healthy routines. It's important to make efforts to eat well, exercise, and get enough sleep. We know that stress is a big modifier of hair loss, specifically telogen effluvium, which fortunately is a non-scarring form of alopecia, but stress can modify many disease processes. So it's important for us to live as balanced as possible. And also remember, control what you can. So focus on the things that are within our control. So we know that we're really motivated to be compliant. We've seen our board certified dermatologist. We have our treatment plan. We're leaving our clinic armed with the information to feel like we have a plan for success. So maintaining your homework, right, which is your topical and or your oral treatment regimen prescribed by your alopecia medical provider. Hopefully it's a board certified dermatologist. And to establish routines to give our days and weeks some comforting structure. Okay, so during the visit with the dermatologist, I do have some people that feel like taking photographs or measuring hair, taking trichometric measurements, which for many patients can be the number of hairs as well as the thickness of each of those hairs, can potentially be a source of anxiety. So it's a-okay to request from your doctor if you don't want photographs to be taken. And I do have several patients that say, listen, I would really rather that we don't have photographs, but please understand that photographs that are used in a physician's electronic medical record are confidential, and they really are a way to help us to gauge the impact of our treatment on your care, right? To gauge the success and the current severity of your hair loss. However, it really is important for us as physicians to honor your requests if you don't want to have those things included in your chart. But I personally do hope that many people do, because it's really important source for us to gauge progress and response to therapy. So this one I really cannot stress enough. Setting expectations is hugely important. And I think one of the most important things, and really should be done from the initial visit. So these are the mantras that I follow specifically. So one, when talking about hair regrowth, remember that hair regrowth in the setting of scarring alopecia is less likely to occur. And especially the longer your scarring alopecia has been present. However, increasing background hair density, which means keeping more hairs on your scalp at any given time, is more likely achievable, especially with medications like low-dose oral minoxidil, like Dr. Farah spoke about earlier. This is a medication that I have many of my patients with scarring alopecia, and there is emerging evidence showing that oral minoxidil can be helpful to increase the background hair density in patients with scarring alopecia specifically. And remember treatment regimens. And it's no joke when people say, you're really throwing the whole kitchen sink at me. And I said, you're right. I am throwing the whole kitchen sink at you, because we don't know everything about the pathogeneses of scarring alopecias just yet. And we really, because this is something that we consider a trichologic emergency, we don't want to do one thing at a time and then take the risk of something not working and then losing hair and potentially not having the ability to have it come back. So most of us will practice polypharmacy, meaning more than one medication. And as people improve over time, simplify someone's treatment regimen. So remember, your treatment regimen, especially early on at your initial visit when the inflammation is most likely to be active, will likely at least involve one anti-inflammatory treatment in addition to an agent that can help to increase your background hair density, like the low-dose minoxidil that we spoke about just earlier. And then once your inflammation is gone, the anti-inflammatory treatment or treatments, whether they're topical or oral, or light treatment like the excimer laser that Dr. Farah had spoken about, may be stopped. However, the agents that have been used to increase your background hair density or thickness, like low-dose minoxidil, really should be continued in perpetuity in order to maintain your benefit. So let's talk a little bit about support groups. I hope if you haven't attended our alopecia support group specifically through the Scarring Alopecia Foundation, I urge you to. They're a wonderful source of support, not just for ourselves, but for each other. And you can see if you visit the Scarring Alopecia Foundation, at the bottom left-hand corner is the link specifically to the support group page. And these screenshots were taken specifically from our page. You click on support, and then click here to be added to the invitation list. So I urge everyone today to join our support groups, because they're a wonderful safe space for people to share stories if they so feel inclined or comfortable to share their journeys. And I think it's a really wonderful way to show people that you're not alone, that other people might be struggling with the same exact things that you are, and that by talking through it, it can help to be really therapeutic in your journey with alopecia. Financial cost of seeking care. So this was a study that we did at NYU, and we had 100 total participants with both scarring and non-scarring alopecia. Smaller cohort, approximately 10%, were patients with scarring alopecia specifically. And we found an astounding 70% of people used camouflaging agents, and over 50% of those people spent over $500 on those agents. And insurance did not cover costs for nearly all of those who purchased camouflaging agents, with 83% of people reporting mild to extreme stress due to lack of coverage. Additionally, a greater proportion of patients, specifically with scarring alopecia, spent over $500 on either over-the-counter therapies or camouflaging agents compared to patients with non-scarring alopecia. So we know that there's a significant financial burden to scarring alopecia as well, and this is something that we want to help to bridge this gap. So let's talk a little bit about societal pressures or beauty standards. We know that the traditional beauty standard is that women have to have a full head of hair, oftentimes straight or longer hair, and we can tell that by this title of an article that was posted online specifically recently shows us how far we really have to go for acceptance of female beauty standards in this country. And this headline reads, "It takes a thick skin to rock a bald head, meet the women embracing hair loss." Hopefully we don't have to have headlines like that anymore, because we can be accepted for having hair or not having hair and still being considered beautiful, not just by ourselves, but for society as well, because it's no secret that societal standards often shape the way that we think about ourselves. And so that brings us to public figure or celebrity announcement. And there have been several celebrities that have publicly come out with their struggles with alopecia, both scarring and non-scarring alopecia. And it's really important for them to share their stories, because this can, one, likely shift the traditional beauty standard regarding presence or absence of scalp and body hair, increase the discourse regarding these conditions, as well as help to reduce stigma surrounding hair loss. So let's talk about a little bit about hair camouflage. And there are many types of scalp prostheses or camouflaging agents. If you have diffuse hair loss or hair thinning throughout the entire scalp, then a full wig or cranial prosthetic is probably the best way for camouflaging. If you have hair loss specifically at the vertex or at the crown, then having a demi wig, including a toupee that oftentimes men will wear, can be helpful. And if you have hair loss impacting both of the crown, which is the vertex, as well as the back of the scalp, which is called the occipital scalp, then a wiglet can potentially be helpful as well. Don't forget, there are also other camouflaging agents, including topical hair fibers and pigmented concealing powders, as well as micropigmentation and microblading. One thing of note for topical hair fibers, like Topic or other colored hair fibers that you can color match, those are oppositely charged to the hair. So you have to apply it to an area that has even a slight amount of hair growth still present. If you apply a topical hair fiber that's charged to an area that's completely devoid of any hair, they'll clump on each other and not look very natural. So those fibers really have to be specifically put on areas that have hair. Even if it's very thin and light colored hair, it's better to have hair present so that the fibers have something to stick to and they don't stick to one another. If an area is completely devoid, that you might want to consider more of the pigmented concealing powders. I get a lot of questions in my practice about micropigmentation of the scalp and microblading of the eyebrows. And I do have several patients with scarring alopecia who have successfully done these. But one thing of note is, in many types of scarring alopecias, there's a term that we use in dermatology called Kebnerization. And this means that these conditions, the inflammation in these conditions, can be reactivated by physical trauma to the scalp. And to my knowledge, no one's actually done a study quantifying what is the risk if someone is putting a needle into your eyebrows, which can be affected in several types of scarring alopecia, most commonly frontal fibrosing alopecia, or putting a needle to put a tattoo pigment into your scalp for micropigmentation. Can that potentially reactivate inflammation in someone who's had no inflammation, or what we call quiescent inflammation, for years? We don't really know the answer to that because nobody's quantified that. And so this is how I counsel my patients. If someone wants to do micropigmentation on the scalp or microblading of the brows, I ensure that they don't have any presence of inflammation, number one. And number two, I tell them I really want to continue you on something that's anti-inflammatory, whether that's an oral agent or a topical agent, as a preventative measure, because we know the risk is theoretical. It's likely not zero, even though we don't know what the specific risk is of reactivating inflammation. So that's what I specifically tell my patients. But those things are available for us. So let's keep everybody engaged. This is our audience poll question number 1. Quiz. What is the average cost of a high quality wig? Is it $100 to $499, $500 to $999, $1,000 to $5,000, or more than $5,000? Give us your best guess. Don't worry, we'll give you the answer and we'll talk about it here shortly. Okay, I can see that we don't have the poll up specifically for people to answer, I don't think, but don't worry, we'll go through this together. So the answer here is $1,000 to $5,000. Sorry, I don't know how to get rid of the writing that's on the screen right now. So unless someone from SAV can help me out with that. So the answer is $1,000 to $5,000. So remember, you and your dermatologist can be your best advocate. Wigs or cranial prosthetics can be very expensive and cost prohibitive for many. The average cost of a wig is between $1,500 and the upwards of just below $4,000, which is significantly expensive. Dr. Senna at the Leahy Clinic did a wonderful study in collaboration with NAF showing that 66% of participants found their wig insurance coverage to be inadequate. This is very significant when the majority of patients feel, and when we already have evidence to show that wigs can increase quality of life in people with alopecia, and that the majority of people find their insurance coverage inadequate. Remember that your dermatologist can write you a prescription for a cranial prosthetic. And this is important. This will be necessary in order for it to be covered by insurance. Unfortunately, till this day, insurance coverage remains very inadequate. And that's what brings us to our next point, which is advocacy. But first, before we talk about that, I wanted to highlight this wonderful publication in the International Journal of Women's Dermatology. And this group of researchers actually gave in their peer-reviewed journal article an example of a letter of medical necessity. And so this is one that you can consider saving, or even better yet, sharing with your dermatologist to help them in writing a letter of medical necessity for you, because that letter will need to come from your medical provider. And then remember, I've put the link to the article itself on the bottom left-hand corner. Okay. So how else can we help to advocate? Remember, everybody makes a difference. And so this is the HR 4034. It was renamed this year because unfortunately last year it was not adopted by the House. This year there's actually a Senate companion bill, and the National Alopecia Areata Foundation, who is now also collaborating with the ScarringAlopecia Foundation, is really partnering to help to advocate to increase the awareness of this as an issue, and ultimately trying to advocate for both the House and Senate to approve this bill. If this bill was approved, it does reclassify a cranial prosthetic or a wig as a piece of durable medical equipment and thus eligible for Medicare. And this would assist patients with any type of medical hair loss. Of note, if something is adopted by Medicare, the general standard is that many commercial insurers will follow suit. And so that's why starting at the federal level for Medicare is an important way to start advocating for commercial insurances to follow suit. And so, like we talked about in the previous slide, writing a letter of medical necessity from your dermatologist and an oncologist if a patient has alopecia in the setting of chemotherapy or cancer therapy, or your other medical provider would be necessary in order to potentially get coverage. And so while we can write letters of medical necessity now, bills like this can potentially help to greatly increase our access to cost-effective wigs as a part of our medical plan. And so so how do we help to advocate? So through the National Alopecia Areata Foundation, I'm one of our support group leaders for that organization for patients with alopecia areata. And myself, Allison, who's the young lady who's holding the sign Wigs, Lindsay Sullivan, who's holding the sign Choice, she's our support group leader through NAF. We paired up, the three of us and Allison's mom, Julie Yu, to form the Alopecia Justice League. And we really did this specifically to help as legislative liaisons through NAF and to advocate specifically for this wig bill. And so how can you help to get involved to advocate for this? And so Allison, who's the one in this picture here, actually created a way that you can log on to this website, share your information there, and it's actually in less than 1 minute templates the letter for you. And because of your demographic information, automatically sends it to your local representative. And so if you don't have the time and or the bandwidth to commit a significant amount of time to advocate for this, this is a way that that the AJL, in partnership with NAF, can really help to advocate. So please consider contacting your local representative and using this method, because it's a very quick and easy way to do it. I did it months ago and it took me probably about 30 seconds to do. And so it's a great way for us to all get involved in advocacy work. So check it out. Okay, so ready for our audience poll question 2. Do you worry about yours or your loved one's ability to cope with scarring alopecia, worry about your ability to support them or yourself throughout your journey, or worry about others' perceptions of yourself or your loved one? Okay. Okay, so sharing our results here, out of nearly 120 people, nearly 90% of people said that they were worried about one of these things. So when making this PowerPoint, my lucky guess was that the majority of people, right? Because we know that this has a significant impact on quality of life, not for ourselves, but also potentially for family members as well. Okay, so this brings us to our next thing. What has the Scarring Alopecia Foundation done, and what are we looking to continue to do to help to impact research specifically for patients with scarring alopecia? First, there's the CAP-AIR study, or the Cicatricial Alopecia Patient Assessment and Impact study, and the outcomes of this project are threefold. One, create a comprehensive, publicly available, validated report that identifies the unmet needs of the scarring alopecia patient community for clinical and scientific research purposes. 2, to identify the psychosocial priorities to be addressed when living and coping with permanent hair loss. We already talked about the established evidence for this. And emphasis of the physician and other healthcare education for earlier detection and diagnosis to prevent progression, because we know that early detection is very important to help to preserve that hair follicle right before it's potentially gone completely. Next, we have our prevalence study, and we already know that the prevalence is increasing. The data that I quoted in the beginning of this article, of this lecture, was from 2013. Right, so many years later, we know that we need to. The current published data is out of date, and we know that there are reports of emerging epidemic for many types of scarring alopecias, and so we want this data to be up to date and really reflect what's going on currently. We have many of our Scarring Alopecia Foundation physician experts that often speak anecdotally of an increasing number of new patients that we see with scarring alopecia. And one of our clinicians recently cited that 60% of their patients in their clinic are diagnosed with scarring alopecia. So that's pretty astounding. So we know that it's much higher than what's clinically reported. And additionally, SAF is working to advocate for ICD-11 coding to include FFA and CCCA diagnoses. And this is ultimately to help to better report, as well as for insurance coverage, right, for therapies for both of those types of primary cicatricial or scarring alopecias. And then also there's clinical trial patient notification. So SAF would like to partner with institutions on investigator-initiated smaller trials, first starting with Janus kinase inhibitors or JAK inhibitors, because those are the 2 FDA-approved therapies already to treat alopecia areata, and it's emerging And the results are promising in an emerging source of research specifically for primary scarring alopecias as well. So support. So how can we get involved? So monthly support group meetings, like we've said. SAF also has a patient outreach volunteer peer-to-peer connections program. There's our Meet Our Members section. And we've got the website at the bottom right-hand corner here. And remember, each person can make a difference. And so please consider reaching out to your local representative, get involved in NAF, whether that's through support group meetings or through philanthropic support for our research endeavors to help to advocate for you and for other people in this community. So these are my conclusions. Hair loss is certainly more than a cosmetic concern. It causes a significant negative impact on quality of life and increased risk for psychiatric conditions for many. In addition to medical treatment, counseling, cranial prosthetics such as wigs, and support groups are wonderful resources to help navigate life with scarring alopecia. And more research and advocacy are both necessary to help advocate or advance our understanding of scarring alopecias, as well as increase access to valuable medical and supportive treatments. Here's my shameless plug. Dr. Shapiro and I have a radio segment on NYU Doctor Radio, and that's Sirius XM channel 110. So if you have Sirius XM, please log in. We have a fellow hair expert at Leahy Clinic, Dr. Marian Senna, who also happens to be our upcoming special guest this coming Thursday, December 14th from 6 to 8 p.m. Eastern Standard Time. So please tune in if you've got Sirius XM. This is a live radio show where we talk about all things alopecia related, and we actually also take live callers on the show, as well as answer their emails as well. So we hope that you can participate. These are my references. A huge thank you to our research fellows, Michael Bontempo and Lina Alhanchali, and thank you so much to Lina Alhanchali, who helped me with this PowerPoint presentation today, and to our current medical student research fellows at NYU, Ambika Noria, Disha Desai, and Michelle Sikora, who all helped to run the SAF social media account. Thank you so much, guys. We really could not do this without you. It really does take a village. Thank you so much.
Thank you, Dr. Losico, for speaking on this essential topic and bringing up many helpful and practical points, also in encouraging taking steps towards support and advocacy.